Good morning, everybody, and welcome to the fourth episode of a series of interviews in which I'm asking the public to decide really whether there's a correlation between some of my patients' symptoms developing and a link to a certain medical intervention. So I'm delighted to have with me today Steve, who is part of the Scottish Vaccine Injury Group, and really just to start the conversation, really just hand the microphone over to Steve, and just if you could give us a brief just introduction of yourself and the Scottish Vaccine Injury Group, why that was set up, and also then just touch on what your health was like before you came into contact with any of the aforementioned medical interventions.
Absolutely. As David says, I'm part of the Scottish Vaccine Injury Group. The group was set up by Ruth. A lot of people will know Ruth. To basically find other people in Scotland that have been injured by the vaccine. We're also part of the Scottish COVID inquiry, and we're part of the UK. We've got core participant status in that, so we'll get to tell our stories in front of the people that matter, hopefully.
Yeah, I guess
So
my first observation would be that you've had to set that up as an independent organisation rather than the Scottish government.
Yeah,
it would be my first
absolutely.
comment really to make, which is really just obscene, really, in terms of not getting the help that the government should be giving you, really, in return for what you've experienced. But anyway, I'm going to try and be as neutral as possible. As I said, if you can describe what your health was like, just coming in, and how old you are, and were you on any medicines prior to the vaccine experience?
So prior to the vaccine, obviously the COVID thing had started. We had a few guys off in furlough. So being part of a small team, 3 guys out of that squad was got a lot of pressure on everyone else. So I mean, we were working 12-hour days most of the time, working weekends. But my health is good. I mean, don't get me wrong, I was overweight, which most guys my age were. But no medication. I was doing my job. I was jumping in and out of containers. That was part of my job.
Yeah.
So yeah, no medication before.
And how old are you? Sorry, I don't know if you said.
I was 47 when I took the first job, but I'm 50 now. Yeah.
50 now. Sorry to bring age into it. For
Yeah,
context.
it's fine.
So I just wanted to go back to the day really of when you decided to take the COVID jab. What was the thinking there? Was it pressure, or was it kind of a decision you'd come to it with your own kind of thinking and weighing up for yourself, or what was the sort of reasoning there?
Well, basically, I got my first job on the 7th of April, so it was like 3.5 weeks before the event. We were told by the government that we needed to get vaccinated to save killing our elderly parents or vulnerable parents. So me and my brother were both carers for my mum, so we basically went and got it for that reason alone.
Yeah, exactly. And why wouldn't you? Exactly for that reason. You were told that it was effective essentially, and,
Yeah,
and you're protecting your
it was
elderly,
safe.
vulnerable relatives, and that's exactly the right reason to take a medicine, and no one was telling you there was any concerns at that point. And so, take me to the vaccine centre. Run me through the setup there. What was your experience of the vaccine centre? I know you've had two, haven't you?
Yeah, well, I'll
What
explain the second
information
one
were you
later.
given? Yeah, well, we'll go into the sort of sequence of events in a sec. But what was your experience of jab one, for example? What were you told? Who jabbed you, for example?
To be honest, I never looked into anything. I mean, the government told us it was safe and effective, so I believed them. I'd left from work that morning to go and get the job done, and it was like herding cattle. There was lanes you had to go down, and I was actually in there for like an hour and a half before I got the job. Yeah, it was.
It's interesting, like you said, herding cattle. I mean, the only time I ever saw the vaccine centre, it was like this lane system, and you'd get a stopwatch, and you'd go in a big circuit, and you'd get jabbed, and you come out the other end, sit for 10 minutes with the stopwatch, it would go off, and then you left, unless you collapsed, that is. What did when the needle went in your arm? Did the clinician introduce themselves? Was it an actual doctor, nurse, or was it a member of the public? Or
I think it was a nurse. Well, she had a nurse's uniform on, so yeah.
And were you given any info at all, or was it just straight in the arm and out?
You're getting AstraZeneca. That's the one you're getting.
Yeah.
which is good because it was made in Britain.
Okay. So you were given the AstraZeneca, and then I'm going to hand the mic over to you really to tell your story. So how were you after that jab immediately, and then the few days thereafter?
Obviously, everyone had a bit of a sore arm when they got it done. I went and sat my 15 minutes, and then it got to like 13. I was like, oh, I'm fine. Went away, went back to my work, no ill effects. The week before the injury occurred, I was actually off on holiday because the guys that were off on furlough were starting to come back. So
Yeah.
I'd asked my boss for like a week off just to kind of chill for a little bit, before we got back into it. So on the morning I was due back to work, we were driving in at 6:15 in the morning because we were starting at 7. And I got halfway to work and just pains across my chest, across my back. I was like a tingling down both arms, pins and needles in my hands. So I'd one of the young lads from work with me. So I kind of says to him, "You're going to have to walk to work. I need to go to hospital." So that's what I did. I did a U-turn, drove to
Just
hospital.
to clarify at this point, how many days, weeks after was this, after the jab?
It was about 3.5 weeks.
Okay.
3.5 weeks. Yeah.
Yeah.
So this was on the 3rd of May. I drove to hospital. I like the reverse park, so I reverse parked in. Couldn't get it into reverse, so I was starting to get a bit of left arm weakness. So I had to use 2 hands to get it into reverse. At this time, there was a guy sitting outside the main hospital ward. Like, do you really need to be here, basically? So I kind of walked past him. I says, "This is an emergency. I need to go." Went in, gave him the details, sat in a chair, and the lady shouted, "You can go down to A&E now." And I tried to push myself up off the chair. I don't know if it was my arms that went first or my legs, but I couldn't stand up. So next thing I was nurses and threw me into a wheelchair and then took me into accident
It was like
emergency.
an evolving picture, wasn't it, really? So things were sort of gradually getting worse at that point.
Yeah,
So,
yeah.
so what were the doctors thinking at that point? Because it's quite a strange presentation, because it's both sides of you, isn't it?
Yeah, well, I remember getting put on the bed, and the doctor was like lifting my arms, and I could see them just dropping back onto the bed. He was lifting my legs; they were dropping back onto the bed. I was like, "What the hell's going on?" And
Yeah.
he's like, I honestly don't know at this point. I thought it might be a stroke, but because you're having both sides of your body are affected, I don't know. We're gonna have to do some tests." So yeah, I think it was later on in the afternoon before they did an MRI scan, saw the blood clot in my neck,
Right.
and said, "You've had a spinal stroke," which was new to me.
Yeah. I
I
mean,
never
if you
had
see
that.
if you see one spinal stroke in your career as a doctor in an A&E setting, you're breaking records really, and so the rare is rare essentially. And so there
Yeah,
you are, some 3 weeks after the jab, you've got a spinal stroke. Did they give you a severity? Did they say it was a big clot? Was it multiple clots or just big one big
they
clot?
they only told me it was in between C4 and C6 vertebrae, so however long that is.
Yeah.
And the day after I was in, they found a PE in my right lung.
So you've got another clot, but in a different area of your body. So this was
Yeah, in my right lung. Yeah.
a pulmonary embolus this time. So how long were you in hospital then for this whole spell?
In total, I was in for 3 months.
3 months, and then out home, or were you in rehab after that for another
Well, I
bit?
spent 6 weeks in the main hospital, and then I spent 6 weeks in the neuro rehab,
Yeah.
helping to walk and do stuff. Yeah.
And what was it? I mean, at this point, are you leaning towards this being a vaccine-related issue as it came out of the blue after the vaccine, or were you completely open to it just being a random coincidence?
I'd never heard of any vaccine injuries before. The doctor that saw me in A&E come up to the ward like 2 weeks after I'd been in,
Mm.
and he had told me that someone else had been in with similar symptoms. He'd asked me if I'd taken a vaccine. I said AstraZeneca, and he says, "Well, this other person, I don't know if it was a guy or a lady, I don't know. This other person's had their job as well a few weeks before.
Mm.
It's kind of the 2 years in the hospital at the same time with the same thing after said vaccine." He says this
Right.
millions to one.
Yeah, exactly.
So,
I mean,
so it's
these
actually
two,
worth it.
as I mentioned, these are rare events anyway, but this is two people in a close proximity of time within a similar time frame after Was it the same? Do you know? Did they say whether it was AstraZeneca that caused
Yeah,
the
that's AstraZeneca as well.
the same one? So it was obviously in that doctor's mind that there's coincidences and then there's super coincidences. So he'd kind of made that link. Is that when you'd started to think maybe there was a link?
No, he told me he thought it was
Yeah.
a vaccine.
So it was him that kind of introduced that concept to you, really.
Yeah, and I suppose my
Did you ever
partner had said
receive
he's
any? I
mentioned it.
mean, during that admission, did you ever receive any other kind of doctors, nurses that had kind of felt that there was a link as well, or was it just this one
No,
individual?
no. And then I never seen him again.
Never saw him again.
So
Did
yeah,
anyone
never
document?
put pen to it.
Was it ever documented in your notes? So it was like a conversation from behind the curtain, really, and then never saw the guy again, and no other link.
Exactly what he did. He shut the curtain. I was him and it was either a student doctor or a junior doctor. So I don't know if they have to like sign into the ward or nothing. I don't know if that's. I've actually asked for freedom of information on that, so I'm still waiting for it.
It's probably been struck off, to be honest. The doctor I'm talking about.
Yeah.
It, sort of long story short here, how has it left you now as we speak today in February 24? What disability have you still got? I know we talked earlier about how much you've thrown at it. Really, you've spent of your own money to try and natural treatments and hyperbaric oxygen, etc., etc. How's it left you now as we speak, and how much would you guesstimate that you've had to spend out of your own pocket to get well
Well,
from this or get better from it? Let's say.
I was actually someone did a GoFundMe for me for a start.
Yeah.
So we made like 4,500 off of that, and I've probably put a couple of thousand of my own money in as well.
Yeah.
So about 6.5, 7 grand, which is not a lot in the scheme of things, but because my injury's so rare, I'm kind of going down the like neurology kind of side of things rather than what everyone else is doing with the myocarditis and stuff like that. So yeah.
So as we speak today, what are your disabilities? I think you showed me your hand earlier. You've got this kind of
Yeah,
fixed.
I've lost my left hand.
Yeah.
That'll never come back. My right hand, I can't put my fingers straight.
Yeah.
They sit curved. I mean, it's better than my left hand. I've got weakness in my right arm. I've lost all the muscles. I'm still struggling to walk long distances. I've got chronic back pain, leg pain. I've been told I've got osteoarthritis now on both hips and across my lower back. And I think there's a considerable gap in between the joints in my left hip. So
it's been completely life changing, this really, hasn't it? It's completely life changing. I presume
I've
you've
lost
not
my
been able
job.
to work as well. I was going to say, so your work and livelihood's gone as well. How would you consider the NHS's role in this? Have they been helpful? Have they been obstructive? Have they met you halfway and agreed there's a potential link for starters? How would you describe your experience of the health service? Have they helped you in any way, or have they sort of left you to it?
When I was in a hospital, don't get me wrong, they treated me brilliantly when I was in hospital. But since I've been out of hospital, I've been asking questions about the doctor that told me I was vaccine injured and stuff. And two of the doctors that came in when I was in the ward, they took in like 20 students at a time. And I remember one of the doctors saying this, you'll probably never see one of these again in your life, in your career. And I was like, but now they're telling me that they're not as rare as you think. So I've kind of been totally fobbed off by them.
Yeah. That
They've
must make
banned
you
them off their
angry as well.
Facebook page. And
I mean, it makes me angry hearing these stories, but I mean, as a victim of this, I don't know how people cope with the anger of it all, righteous anger as well. So we were just discussing before, actually. You've obviously been left without a job here. Having to fund care privately in sort of alternative health sectors. And you applied to the vaccine damage payment scheme that we heard about with Rishi this week when John Watt had confronted him publicly. I'm talking about this vaccine damage payment scheme that doesn't seem to, from my experience of what people are telling me, seems to be fit for purpose. But what's your experience been of it, of the vaccine damage payment scheme, which is, as I said before, I think it's £120,000, isn't it? Which isn't anything in the scheme.
It's that or nothing. Yeah.
It's that or nothing. And so if you tell kind of the people who are watching kind of what is that scheme, and I think, is it £120,000 and you have to hit a certain threshold of disability, which is
60% disability.
60%, which again is very arbitrary. I don't know how you work that out, but so take me through that. So have you applied for that? When did you apply?
So as I told you, when I was in the hospital, the doctor told me like 2 weeks after, I had spoke to my brother, and my brother had found this VDPS on the internet.
Yeah.
So I didn't have a clue what it was. Never heard of it before. So we filled in the form when I was in hospital. It took about 18 months to come back, and I was knocked back the first time because they blamed depression I had when I was 21 years old. Migraines I started getting when I was 18 years old, and they blamed my weight. I was slightly overweight.
So just say that again, just so the people who are watching understand. So they were blaming your spinal stroke, which is as rare as hen's teeth, as they say, that had happened twice in the same hospital, on the migraines that you had in your youth and depression.
Depression. And I was
And
slightly
you've got
overweight.
that in writing that they're blaming your spinal stroke and depression. It's just absurd. Absolutely
I've got it.
absurd gaslighting. But so they rejected it on the basis of those spurious reasons, and then you've had to reapply. And you said
I've done it the second time. I got help from a solicitor down in England, Peter Todd. Alex Kelly, she started up a patron fund.
Yeah.
So she actually paid for Peter to help me. And I was knocked back again.
So the second time. So what again? Did they not give a reason? You say that second time?
Not any new reason. So I'm assuming they're still going with the first knockback. Which I
so
got a letter from a neurologist saying it wasn't those reasons. I had my stroke.
Okay, so the neurologist is supporting you in that respect, saying it's spurious and those three
That's
things.
not the reason.
But
yeah.
Have they actually said, the neurologist, that there's a temporal relationship or a correlation here between vaccine and injury? Or?
They won't go into it.
It's almost like the best kept secret, isn't it? No one wants to sort of put their neck on the chopping block and say what we're seeing here. Powerful story, and thanks for sharing it, really. And I'm just, as always, I apologise on behalf of my profession of what the gaslighting and the lack of help and support that you've had. And for me, I'll show my colours in that. If something keeps happening, you keep seeing a pattern of coincidences. Then, as we said off camera, if a coincidence keeps happening, then it's no longer a coincidence. If rare keeps happening, then it's no longer rare, is it? It's common by default. So. We need to start speaking up. And if you had a message to, I mean, a lot of the time now I'm getting doctors contacting me, tapping me on the shoulder, saying what they're seeing. Even this morning, I've had an email from 2 paramedics that support me privately and want to have a chat with me and share their experience. What would you say to those people that are on the fence about, making that link, that untold link between the jab and the injuries that they're seeing in their clinical practice? How would you get them out of retirement and stop the silence? What would you say to them?
It's about time to grease some balls, to be honest. Yeah, I mean, everyone knows what's happening here, but we need the doctors and the nurses and paramedics to tell people, tell the general public that still believe that it's safe and effective, the real stories.
I think that the time has come now, hasn't it, in February 2024, where it's beyond all reasonable doubt for me. And obviously you're in the communities where you're hearing these stories and these tragedies in real life and how it's impacting these people. And it's not about career and pension and things like that anymore. It's about doing the right thing. And I keep just imploring my colleagues to, if you're going into work today, you put your scrubs on and your tunic on and you're going to be a nurse or a doctor for the day. Just ask yourself why you're doing it. Why bother getting out of bed to play the part of doctor and nurse if you're not going to actually abide by the good medical practice guidance and the Hippocratic oath that you sign up to. So tragic story to hear, and I'm sorry that this has happened to you. And on behalf of everyone, thank you for having the bravery to speak out and organising what you've organised in Scotland. You've got a solid team up there, so I understand, and raising awareness at all times. And so hopefully justice will be brought to you all.
It's pretty bad when vaccine injured have got to help other vaccine injured, isn't it?
It's absurd. It's absolutely absurd. It's absolutely absurd, and it's sickening, actually. So thank you for your time, Steve, today, and take care and all the best. Catch up soon.
Thank you. Cheers. Bye.